Welcome again in the third session on Channel 2. We'll talk today about what could be other than retinoblastoma. Sure, we have no financial disclosure. I will share with you three different cases. When we examined them, we thought about retinoblastoma as a first differential diagnosis. Our first case was a 3-year-old boy. He had a history of 3 days redness and congestion, for which he was given some anticongestant. Then when he came to the hospital, we examined his fundus and we found this lesion. This lesion, this whitish lesion, we found this whitish lesion and we thought about retinoblastoma because this is the first should be excluded in a 3-year-old boy. We sent him for a B scan and the B scan came showing us a mass and possibility of calcification, for which we thought this is a retinoblastoma and we should start with imaging. We sent him for MRI with enhancement so that to see is it active lesion or not, and the MRI was there is no apparent intraocular mass or with abnormal intensity. So what could it be? We are wrong. Is it not a retinoblastoma? What should be? So we went back to the family. We took from them a history again. We emphasized on any illness before their presentation. The mother said that he has a fever, he had a cough, and he was admitted for a bronchopneumonia treatment, so mean he was hospitalized. So here came to our mind possibility of having endogenous endophthalmitis. We consulted our pediatrician and asked him to do for him investigation. He did CBC viral screening, torch, ESR blood culture, and all was normal. So we start with him parenteral antibiotic. Still, there was no much improvement regarding his fundus findings. So we sent him again for the pediatrician and asked him to start antifungal, because there is a report saying that possibility of having endogenous endophthalmitis caused by fungal infection from 11 to 17%. So he started him on amphotericin intravenously, and it was a very good result. So we can see this is 1 week after starting amphotericin intravenous. There is a tremendous response. The haziness went out, and the size of the mass decreased. Unfortunately, we lost follow-up for this child, which is no news. It is a good news. So he is good. So he disappeared. The second case was a 4-year-old boy. On a preschool screening, they found that he has a poor vision in his right eye. So the family consulted the hospital, and when we examined him, we found the subretinal exudates. We have dilated vessels, and at periphery, there is a telangiectatic vessels. So the diagnosis, by default, it is a case of Coats disease. But still, we have something abnormal at the fovea. This is whitish lesion. Is it retinal exudate, or it is a possibility of having two pathologies? It means could be having retinoblastoma and Coats at the same time. So we sent him for the B scan. The B scan was even more, make us more worried, because it say there is a mass, there is a calcification. So we went where? We went for MRI. The MRI again say there is a mass. So what to do? Is it a retinoblastoma? Clinically, still we have these telangiectatic vessels, these retinal exudates, so we think it is a Coats disease. Clinically, it is a Coats disease, but imaging shows and points toward retinoblastoma. So he's a cooperative patient. We asked Dr. Muhammad Asad to do for him a fluorescein angiography, and the fluorescein angiography showed that this is a case of Coats definitely. It is not a retinoblastoma, because having these dilatation, having this peripheral capillary dropout, having this late exudation, and the mass which we are suspecting to be a retinoblastoma, it showed no tumor-related vasculature, and it was was just a leakage. So we were happy to say this is a case of codes 2B2, and it was referred to Dr. Muhammad, and he gave him anti-VEGF and laser therapy. The third case, he is older, 8 years old. He has esotropia for some time, and the family decided that he is 8 years and we should do for him a surgical correction. So when we examined his fundus, we found a large mass, subretinal mass, which is dexapapillary. So what could possibly? Is it possibly retinoblastoma? But he's 8 years and he's having esotropia for some time. So having getting the lesson from the previous two cases, we sent him from B scan, which was normal, and we sent him for OCT. The OCT revealed that there is a choroidal mass rather than it is a retinal mass. Fluorescein angiography revealed that there is a very vascularized choroidal mass, and the diagnosis was choroidal hemangioma, for which he was sent for treatment with PTT, and he was and unfortunately we lost him from follow-up. The last case, it is just the opposite for the first three cases. It is a case of retinoblastoma that was misdiagnosed by the optometrist, and he was sent for the hospital saying that this case has an azometropia +4 in right eye, plus 18 in his left eye. So he was thinking how to treat such an isometropia. But from the first look at the child, you can see that he has a leukocoria, and his fundus show a huge retinoblastoma. So our message to all, leukocoria and fundus lesion should be approached as a case of retinoblastoma till we definitely rule it out. Thank you very much.
Thank you very much, Dr. Suzan.